With us now, let's bring in Evelyn Argirokastritis. She's the president for the Race for Immunology. Thank you so much, Evelyn, for being with us.
Hi, thank you so much for having me.
So tell us, how did you start this nonprofit?
I started and inspired by my son. I gave birth to a son on July 4th, 2017. And I had a huge fight to get him a diagnosis. It took about 7 months of his life, him being chronically ill. So based on our experience with his rare disease and my experience navigating through his diagnosis, through finding him proper care, through finding an expert immunologist to properly diagnose him, I just decided what was lacking in the rare disease field, and I wanted to change it in any way that I could. So I founded Race for Immunology, where we support rare and immunoheme disorders and the patient population, as well as the research and education behind these disorders.
I'm thinking, as a mother, it must have been so frustrating going from doctor to doctor to doctor until you got the answers that you needed.
Yeah, that's when I just started to throw myself into every emergency room and see how far I got. They all knew something was wrong. No one could tell me what was wrong. So a couple institutions later, and then me asking for an elevated level of care brought me to CS Mott Children's in Ann Arbor, who in all saved my son's life.
How is your son doing now?
Great. He is 2 years post-transplant. He had a bone marrow transplant. They diagnosed him with it's called Nemo disease, but it's really the NF-kappa B essential modulator disorder. He was the 22nd registered patient on the registry at the time during his diagnosis, but with further digging, he's the fourth of his kind of the string that he has, and only the second living.
Oh, wow. So with this, Evelyn, can I ask, what's the journey been like for you in connecting with other family members?
Well, it's very hard. So when you have an immunologic disorder or a hematologic disorder, you normally end up on the oncology unit at your local pediatric hospital. So a lot of cancer-focused medicine and cancer-focused programs. So having a rare disease that is non-cancer, you kind of feel left out because there's so many programs offering for cancer, and being non-cancer, we didn't feel like we could associate in those programs or have the same opportunities as these trials and programs. So it was very isolating. And then we transfer into this pandemic, which makes everything even more isolating. So we try to do virtual programs and in our community, and we offer a lot of gifting programs in our patient gifting program, our patient gifting fund. And that's where this book fair that we started, the Read for Rare program, comes into play, because a lot of the toy rooms are closed. Activity centers within the institutions are not running at this time due to COVID. So we provide, since last year, literacy program within these institutions, where we try to donate as many books as possible, because books provide an adventurous escape and take the minds off all the procedures, a lot of the therapies that our patients go through.
We're talking with Evelyn I'm just going to mess up your name.
Evelyn is good.
And I will say that I pulled up the pronouncer and was practicing, and then you pronounced it differently than what the pronouncer gave me. So she's the president for Race for Immunology, and this is a tough time for nonprofits because we are in the middle of the pandemic. How is your fundraising going right now?
Not as well as we'd like, but that's okay. We did a virtual 5K that actually brought in quite a bit of money. So that was great. We just haven't been able to a lot of the in-person programs that we want to do. The in-person concert series where a lot of local musicians have offered to perform for us in order to raise donations as well. And it hurts, but we do the best and we spread each dollar as fast as we can. A lot of our focus and the program that all the donations, extra donations from this Rare to Read book fair are going to, that we're focusing on this month, is our genetic testing program, We provide genetic testing to patients with limited resources that cannot afford the out-of-pocket cost. Whether you're covered with insurance or Medicaid, we will cover those costs. So physicians have been contacting us saying, I have a patient, he's about to go have a kidney transplant, and the family just cannot afford these costs at this time. That's when we just come in and cover all costs.
And have you found, even through your own journey, it can be just as frustrating dealing with trying to get a proper diagnosis as also trying to deal with some of the healthcare industry, providers?
Healthcare industry providers. Well, we've been very fortunate that my husband has stayed employed, the past 4 years while my son has been, we've been dealing with this through my pregnancy, We've learned the ways to navigate through the insurance to cover a lot of these things. How a peer-to-peer is mainly how you have to do it. You have to get your provider on the phone with the main insurance for that department, whether it be bone marrow transplant. Like, they have heads of these departments individually to go, okay, we will cover these costs. We do understand why we need to cover these costs. So we were fortunate in that sense, but many families are not. When our journey, my son had to fight for a diagnosis, then he also had to wait long enough to find a bone marrow match when we did bone marrow drives. And Good Morning America had shared our story at the time, and I had so many families reaching out to me saying, how did you find a physician to listen to you? How did you find a diagnosing physician? How did you get this genetic testing covered? So all this intake that I've taken from our patient population, I'm trying to fund these resources for them.
Yeah, I have a friend who she was diagnosed with a rare disease later in life, but still the journey of getting a diagnosis was years in the making. But in between, she's almost become an expert of trying to navigate the insurance world.
Absolutely. I call myself a medical mom because I did not know what a CBC with diff and a comp and all these types of blood panels and then genetic testing panels and all these tests and procedures. Now I know how to prime a pump, infuse IV medications from home, tube feeds. I know how to insert an NG tube. I do the dressing changes, things you adapt and you learn. And because of the severity of situation, you pick it up and you become a pro in your field. You become a pro in your disorder, which is why it's so important that if you have a rare disease, whether it's later in life, we have a lot of, our community right now is from birth to 55, but it's gaining because a lot of people are realizing that they do have a rare disease later in life and finding, which is hard on the adult side, finding an adult immunologist if you've had problems earlier, that transition from a pediatric physician to an adult medicine physician. There's a lot of things to navigate. And we're hoping to eventually provide all these tools by building our community and broadening our disorder range, yes.
So when you have a rare disorder or a rare disease, how hard is it to get funding for research?
It's hard. You have to navigate through that. You have to find, if there's a certain medication that fits, other trials that fit. There is funding out there. There are grants out there. There are research and education grants. But what's important and what we found so important is partnering, again, with the education and the research side. The education, a wonderful nonprofit, the Clinical Immunological Society, they use their resources by providing extra education for physicians, which is so important. Our diagnosing physician had attended one of their summer programs. And with rare disease, you have to keep your mind open of what patterns can fit. So you can properly take all those patches and make that quilt a finished product and finding that diagnosis. It's all about taking parts of what you could be having, whether the fevers, the rashes, and making it fit. And then the second part is the research side. And we've partnered with the North American Immunological, it's called NICER. It has a very long title, but it's a wonderful expert immunologist group, hematologist group, that they're really dedicated to rare disorders. They're really dedicated to providing proper care for their patients, and they've been wonderful. And we've partnered with them for this book fair. All these institutions have NICER experts in their immunoheme clinics. and they've graciously partnered with us to help us provide books to all of their clinics. We're in Phoenix, North Carolina, just joined North Carolina Children's, University of North Carolina, Rainbow Babies, Cleveland Clinic Pediatrics, Wayne State Pediatrics, CS Mott, 2 local institutions here in Michigan. So we just want to spread some cheer while this pandemic is still going on, and hopefully for years to come.
So how can someone find out more if they want to be able to donate some books to your organization and help you guys out?
Oh, it's really easy. We're at raceforimmunology.org. When you find the book fair, it's linked right there. You can go to raceforimmunology.org/book fair. You'll enter in the book fair right there. You can shop for yourself. You'll be taken to Usborne Books and More. They have they are powering this book fair for us. Stacy, our representative, is absolutely amazing. You can shop straight, and any dollar amount that you spend, 50% of that is earned in free books for the institution. Another way is you can make a straight donation. You can choose to pick a theme of books that you'd like to donate and choose any amount that you'd like. And 150% of that donation will be matched in free books and goes to the institution of your choice.
So Evelyn, just another minute or two here with you on the show. What advice would you give to other parents going through this?
Oh, hang in there. It is so tough. It really is. I've had a lot of downs and thankfully now a lot of ups, but the last 3.5 years were very difficult. We finally found a medication that I inject a chemotherapy that I inject into my son daily that helps him significantly dealing with his chronic GVHD of the skin and his gut. But my advice that I talk to every parent is 30 minutes a day, you need to take time for yourself. I spent 101 days straight in a hospital and never left. Until my son, I knew that he was clinically stable. I could not leave his bedside. So I know how important it is to just take 30 minutes a day for yourself, breathing, doing a little bit of yoga on the floor there, that is fine, but most importantly, try to get outside and walk.
Oh, well, Evelyn, we're hoping that your son continues to thrive. He's so lucky to have you as a mom.
Oh, thank you so much. I'm lucky to have him. He changed our entire world. He let me find my own strength. He's helped me find my passion, which is this. I'm putting all my passion into Race for Immunology and hoping to help other patients in need.
Well, you're helping so many people through this journey. So thank you for putting your passion into that. And I have to say, Evelyn, tell us your last name again.
Oh, Argirokastritis.
Well, that must have been fun trying to learn how to spell that when you were growing up.
Oh, actually, I used to be a Norman, and I married into that last name.
Bless your heart.
Thank you so much.
Well, thank you again for being with us. We appreciate your time. And again, the nonprofit is raceforimmunology.org and then /book fair if you want to help them out. So thank you again, Evelyn.
Thank you so much.